So the NCLEX, or the National Council Licensure Examination for Registered Nurses, is one crucial requirement if you are an internationally educated nurse and you want to practice in either the USA or in Canada. So I took mine last May 7th and fortunately I passed. So in this video, I would be sharing the top 10 things that I did to prepare myself for that day. If you're new here, my name is Fabb. I'm an internationally educated nurse and finally a registered nurse here in Canada. So if you are an internationally educated nurse and you're gonna take your NCLEX soon, better watch this video. There are 10 things that I would run through this video. Those 10 things are the things I personally did. I am not guaranteeing anything that if you do this, and this, you would like necessarily pass. I'm gonna explain it in one of the items later, but yeah, take it with a grain of salt. Okay, so the first thing is to set the schedule for your exam first. I believe that I know myself really good, and I know that if I schedule it really far ahead, then I won't have any motivation to do it. Or like I'm a crammer, guys. I'm a procrastinator, I'm a crammer, and I believe that like scheduling it really far in advance would not be the best situation for me, because I know myself, I'm gonna, even if I schedule it like a month or 2 months in advance, I know that I would just like really focus on reviewing in the last 2 weeks before the exam. So it's really up to you when you want to schedule your exam, but I really suggest to have a schedule first, because for me that's the external motivator. I am motivated by deadlines. If I did not schedule any exam, I would forget about it and would review like in the last 2 weeks of the exam, or even like, you know, for me, scheduling it first would kind of force you into making a plan, strategizing, really motivate you to really study, really be focused on it. So yeah, that's why I scheduled it first. Yeah, so that's the first one. You schedule your exam whenever you feel the need to schedule it. Second tip is to really know yourself. When I say know yourself, I would like you to assess like, am I ready to take the exam? How much studying do I need to do if I would want to pass the exam, of course, and I believe that you want to pass the exam, right? Another thing with knowing yourself is knowing your strengths and your weaknesses. What I did was I made I made this like list of topics. So I listed all the videos that I wanted to watch in the Archer's like subscription. I triaged it. If you know, I put emergent, priority, and non-urgent. So the videos in Archer, I listed all of them, and then I put it in columns. So the emergent stuff are the things that I really think I should really watch. I mean, like, I'm not gonna take the NCLEX exam without watching these videos or these topics. For example, test taking strategies, delegation, electrolytes, which is really confusing when you don't like refresh your memory. Also pharmacology, maternity and pediatrics, because in my re-entry program we didn't have a lot of classes about it, so I felt the need that I need like to touch up on maternity and pediatrics, and also mental health, therapeutic communication, because like from like my readiness assessments and the practice questions, I really noticed that there's a lot of mental health questions, therapeutic communication, like how would you respond to the client, So yeah, those are the things that I written here, and like as you can see, it's all highlighted because I really watched all of them. Priority are like second line. Non-urgent are like the system by system review, which is like, for example, cardiovascular system. I know a lot of cardiovascular system topics, or like I know a lot about cardio because I used to work in a cath lab, like blood flow to the heart. This is something that I can explain to you like right here, right now, without reviewing anything. I could draw and think. I don't know why I like cardio so much. I would really suggest you doing this because you would focus on the things that you are weak at. So for example, pharmacology. I had like I needed to refresh my memory with all the pharmacologic concepts and stuff. So yeah, that's number 2. So number 3 is to take practice questions. Of course, you have to know how to do the test taking strategies. You have to see how the questions are formed. So in NCLEX, some questions are really tricky. So you have to really know first if you're looking for the positive ones, or for example, prioritizing patients. You need to know if you're looking for the most crucial ones, or if you're looking for the one that you could send home or discharge. So you have to really read the questions and be familiar with the type of questioning the NCLEX questions have, because it's really tricky. I read the questions like 2 to 3 times because somehow there are times that I feel like when I read the first question right away, I would, this is the question, for example, letter B is the question. But when I read it again, like, it was looking for the wrong thing, not the right thing. So I had a lot of I've encountered a lot of situations like that. And the only way for you to familiarize yourself with questioning is like to answer practice questions. Also, what I like about archers is that they have unlimited readiness examinations. So what I did was to answer at least 2 readiness examination every day, because I only have 2 weeks, right? I would watch the crucial videos first, then answer, then the rest was like really just practice questions. I would do like 2 to 3, sometimes 4 sets in a day. I would sometimes use my laptop because like that's where you're gonna answer, but whenever I'm awake and I can't sleep, I would answer it on my phone. So yeah, 2 to 4, and like per readiness examination, those are like 85 questions, so around 200 to 300 questions per day. That's what I did because I'm like crunch on time. But number 4 is I prefer watching videos because as you know, like me and videos have like a really good learning and teaching relationship. So I really like watching videos. I found that Archer videos were really straight to the point and simple, and it's just like I felt like I have like a professor or an instructor in front, and it's not that formal. That's why it like resonated with me really easily, and it made me memorize things or like remember things really easily. But again, I made the list, right? So I watched the crucial videos first. I watched the emergent videos first. Yeah, but like I have classmates who didn't really watch any video, just do practice questions. I also had a classmate that just watched, like, for example, pediatrics and maternity and mental health videos, but in the rest they would just like answer practice questions. But again, it's up to you. I prefer having, I had time during, I had like focus time during those 2 weeks, so I was able to watch a lot of videos as well, that I think is really important for answering the examination. So I did that. And yeah, I really liked how archers I really like how Archer um, organized the videos. And also they have like crash courses, so if you only have 3 days, just do the 3 days one. And okay, that's number 4. Number 5 is take notes on the important subjects. So I use my handy dandy notebook. It says chase your dreams, and I did. Oh, sorry. I did chase my dream, so here it is. But like, I want to show you like how much studying I did in 2 weeks. Did like the emergent ones, and also like I put affirmations. Look, I am a good slash great nurse, because like really, sometimes I doubt myself. I doubt like knee-jerk reaction to questions. Mostly when I answer practice exam now, I would just say like, what would I do? Like, I'm a good nurse. What would I do? What's the safest thing to do? And usually that's the answer that I did. This is how much I wrote. I even bought like a Muji ball pen because I really like my penmanship on that Muji pen, because it was a gift from Wagamumu. Hi Wagamumu, if you're watching. I know you're watching. But yeah, mostly pharmacology, nervous system, the electrolytes, because I know like, oh, like fetal heart rate, monitoring the stress, non-stress test, things that are really confusing. I wrote it down. You don't need to do this, but I did it, because partly I believe that when you write something, it would make you remember it easily. But I believe that if you write something down, it would, be written in stone in your head. So I took notes on like the crucial subjects, and then the rest, if I wanted to watch a video, I would just watch it. Number 6 is motivate yourself. So I took the Philippine Nursing Licensure Examination, right? And in the Philippines, we have what we call review centers. So we would pay them, and they would give us like practice questions. They would ask us to attend lectures. I'm not sure if they have those kind of things here, but mostly NCLEX is like a self-paced thing. I believe that I am more of a like formal structure education kind of person when it comes to like nursing and review. So I really need to motivate myself. What did I do? I printed this because I really wanted my microphone. I printed this, I pasted it on my wall. And it did 2 things for me. One reminded me that I had to like review because I wanted to get this. And second one is whenever I am crying, I'm anxious, I am overwhelmed with reviewing, I was up like midnight, I feel like I wanted to quit, or like I don't want to review anymore, I'll just look into this photo right here and remember what I am doing this for. I don't know, it worked. So find a way to motivate yourself. It may not be this, or it may be a trip, or I don't know, if you really wanted to eat at this restaurant. I suggest like giving yourself a bit of a prize so that you would be happy while you're doing your reviewing. And I also believe in and I also believe that when you enjoy the thing that you're doing, you will have more relaxed aura come examination day, or like you will feel more relaxed while you're reviewing. Also, your memory will have a better grasp of what you're reviewing, because you're not stressed, you're having fun, and that's how I learned best. So yeah, I finally got it. Moving on. Number 7. Whenever I have like an important test, for example, the Philippine Nursing Licensure Examination or this NCLEX, I really identify what are the things that I want to sacrifice. So I usually sacrifice social media for 2 weeks. I really rarely open social media. I deleted the apps. I'm only reachable through Messenger or like in iMessages for emergency stuff, because I get like dopamine hits whenever I watch reels, and I'm gonna waste a lot of time watching reels. I could utilize them for reviewing the NCLEX, right? Also, I didn't hang out with a lot of friends unless they are there to review with me. I really had to explain to them that, I'm doing an exam and I need to really focus. They would understand. If you're their true friends, they would understand. Shout out to my friends. Number 8 is like asking a friend to review with you, because I also believe that if you are productive with another person, it really helps you keep the productivity. I think it's called like body doubling. Like if there's someone in the room, or like someone is watching you like be productive, you'll kind of be forced to be productive as well. So it would be nice if you would review with a friend who's also taking the NCLEX, so that it's beneficial for you both. Okay, we're down to the last 2. Number 9 is manage your anxiety. I really believe that you can be really smart, you can be really you can spend a lot of time reviewing, but if you got anxious during the examination day, things will go blank and you will hyperventilate, you will panic, you will start choosing the wrong answers. Also, I really highly suggest that you stop reviewing like a day or 2 before the examination day. I only had 13 days, so I stopped like 1 day prior. But if you are been reviewing for a lot of days already, I really suggest that you stop a day or 2, so that you would focus on just managing your anxiety, stress, all the intrusive thoughts. It really would pay a lot to be able to focus on exam. Things that I did to manage my anxiety: I would cry. I'm a big crier. When I'm stressed, I cry it out. When I'm stressed, I would stop reviewing. I would deep breathe, and I would, eat something that I really liked. So that I can continue, like reviewing in the future. Anyway, so those are the things that I did to manage my anxiety. And last but not least, I prayed. I am very spiritual. Like, I have this relationship with my creator, and for me it really helped with my anxiety, with my test anxiety. Also makes me feel more powerful, or it empowers me whenever I pray. So that's it, guys. Those are the 10 tips that I can get. Those are the 10 tips that I can give you for taking the nursing licensure examination. I hope that you've learned something from this video. If you did, a thumbs up would be really appreciated, so that I would know to make more videos like this in the future. Also, if you have questions, don't hesitate to comment in the comment section. I really pray that everyone who's watching this video would pass their examination. I know that you got this. You're a great nurse, and I'll see you on the other side. I'll see you on my next video. Stay fabulously brave and beautiful. Bye!